Hi there, it's Dr. Heyer from Holistic Health, where we use functional medicine to help sick people get well and help well people stay healthy. If you've been watching our recent video series, we've been going into more detail on how functional tests can help people get answers to questions that maybe they're not getting someplace else. And in today's video, I want to talk about a subject that's very sensitive and concerning for a lot of people, and that is infertility. And according to the National Fertility Association, there's only about 60% of couples who can actually conceive without medical intervention within the first 6 months of trying and making attempts. That breaks down to 1 out of 8 couples who can actually conceive under normal circumstances without any some type of intervention, and that leaves about 17.4 million women with questions and tears. Now, most of the time we're going to look at hormones when it comes to infertility and things like that, but it's not just looking at hormones from a functional perspective. We actually have to look at what could possibly be affecting those hormones, and sometimes there are deficiencies in minerals and vitamins and even cholesterol, things that our body needs to make those hormones, because without the building blocks, without the building materials, you can't build a house. Without the right building blocks, you can't make good hormones. There can also be things like toxicities that affect or impede the recycling or the production of hormones that are necessary. And there can also be disease states like diabetes and obesity. Those are things that can cause an effect as well. Now, so what do? Well, we want to do comprehensive functional testing. Yes, we want to look at hormones, but we also want to look and see if that person's truly healthy enough to have those building blocks that they need, not only to conceive, but to continue to conceive, to carry the baby to fruition all the way through the pregnancy. And in many times, not only are we doing functional nutrition, supplements, detoxes, and things like that, but we use acupuncture a lot in our office as well. But I also need to make sure it's clear it's not just a female problem. Half of the time, the guys can't make good swimmers. They're not either healthy enough, they don't swim long enough, or they don't have enough. Many times a male can be deficient in minerals that they need to make good sperm. So it's not just the ladies, and unfortunately, the weight of that inability to become pregnant kind of falls on her shoulders when it's not always on her. It's not always her issue. So if you or someone you know is struggling or dealing with something like infertility or having a hard time conceive, please check our link below. We have a link that you can go to our functional medicine page, and we'll be happy to do a 10 or 15 minute consultation, no charge, just an opportunity for us to have a conversation to see if you might be a good candidate for the tests and the protocols that we use. Okay? Hey, do me one last favor. Can you smash that like button and share with your friends and family, and have a great afternoon.